You are listening to the Horse Radio Network, part of the Equine Network family.
Greetings, everyone. Coach Jen here, and thanks for tuning in to Horse Tip Daily, episode 1562. Today's tip is an excerpt from the Horses in the Morning podcast, where co-hosts Jamie and Glenn sit down with Dr. Jose Garcia-Lopez from the University of Pennsylvania's New Bolton Center, and they learn all about equine meniscal injuries. And we'll get right to it after a word from our sponsor, MyNewHorse.
For first-time horse owners and new riders, finding the information and support you need can be challenging. That's why Equine Network has partnered with Sentinel and Absorbine to bring you MyNewHorse. From important horsekeeping information and how-to videos to social media communities, exclusive experiences, and more, MyNewHorse is your one-stop shop for riders of all levels and disciplines looking for easy-to-understand horse care information and guidance. Start your horse ownership journey today. Visit MyNewHorse.com.
I would like to welcome to the show Dr. Jose Garcia-Lopez, the Associate Professor of Large Animal Surgery at the University of Pennsylvania's New Bolton Center, which is one of the greatest places in the entire country. Hi, Doctor. Thank you so much for joining us.
Thank you for having me.
Equine meniscal injuries. So tell everybody what that is.
Yeah, so not dissimilar to the human athlete, for example, horses do have menisci in their stifles. And at times, especially with sport horses, in particular jumpers and dressage horses, they will suffer different degrees of tears of laceration of the menisci, which result not only in discomfort, but potentially significant level of lameness. And, it can be a threat to their athletic activity. The way that they occur is a little different than what happens in the human athlete, in which in the horse, actually, the tears appear to occur during the last phase of the stride, meaning during full extension rather than inflection, which is where you see in other species, canine, humans alike. So it does bring some different challenges with regards to their management and also the way that these injuries occur or the way that they tear, because of the tearing is different than what happens in other athletes. So
it happens, like you're saying, the extension phase. So is it common in racehorses?
It's interesting. It doesn't seem to be. They do occur in racehorses, but not as much as with sport horses because of the slow extension that happens with some of the dressage and jumpers, and then also the landing and pivoting and that quick turn that they sometimes have to do. That combination is what appears to create the issue. And part of the issue is that during extension, that meniscus, which is fairly immobile in the horse's stifle, during extension, it does have some translocation forward or cranially. And that's where sometimes it can get crushed, especially when you extend and you also turn.
Okay, gotcha. So does it present just as a hind end lameness and you have to just start working your way up?
Exactly. So usually will present as a hind limb lameness, depending on the grade of injury. It could be anywhere from mild to, a mild lameness that sometimes only the rider can feel. Those are the least severe injuries, to ones that the patient is even non-weight bearing or toe touching. So the grading can vary quite a bit. But it gets worked up like any other lameness evaluation with your physical exam, palpate the joints, and then if there's nothing clear on your examination, then you can start doing blocks, either working from the bottom up or going to the joints to try to desensitize and try to identify the lesion. Or to sort the joint to then go into your diagnostics.
So then it would be an ultrasound once you've kind of linked it to the stifle.
Yeah, like the first line of defense is basically doing a combination of ultrasound and radiographs. Just the radiographs, just to have an idea of the morphology and the bony structure per se, and then the ultrasound to be able to identify not only the menisci but also the other structures within the joint, like the synovial membrane. You can look at the cruciates, you can look at the collateral ligaments and patellar ligaments, etc.
So, say you've got a tear in the meniscus. What do you do? Is it stall rest? Can you do surgery on it like you do with humans?
Yeah, so that's a really good question, and that's actually one of the things that we get asked quite a bit. And you can rest some of the mild injuries. However, the challenge that we have with menisci injuries, not dissimilar to what happens again in humans, is that the meniscus is basically, just think about a pillow that lays between the two bones, the femur and the tibia. And it helps basically make up for the incongruencies of a joint. A normal joint is usually a ball and socket type of thing. So you have a concavity and a convexity, and they both fit. A stifle, it's a flat structure, which is the tibia, and a round structure that is the femur. So that is not a ball and socket. And in order to kind of make that ball and socket, that's where you have menisci. And the menisci are kind of like these pillows that make up for that curved shape that the tibia does not have to complete that ball and socket, as I mentioned. But the menisci is made of components like collagen within it. So when you tear your meniscus, that collagen gets exposed inside of the joint, and it actually has almost like a foreign body type reaction. So the joint responds by making quite a bit of inflammation. That's why you have so much effusion and thickness and proliferation of the synovial tissue, etc. So even though you can rest it and also do some injections like biologics to try to cool it down, if you have a significant injury, you have not only a piece of the meniscus that might be mobile and might be irritating because it's not supposed to be mobile like that, but also that exposed tissue creates a vicious cycle of inflammation that can also further deteriorate the joint. So for that reason, when we ultrasound and diagnose them, if it's something that is significant enough, going in there surgically via arthroscopy, in which you do it under general anesthesia, you can actually just put a scope the same way that they would scope your knee, which actually basically we use the same equipment as in the human orthopedic side. Then you explore it, you identify it, and then you can debride the area that is affected. We do not suture menisci back together for the most part, like sometimes they do in humans. Part of it is because of the way that the lesions happens are different because of that extension. It just creates more of a crushing and tearing versus just a split. And the other part is also that we need to make sure that our equine patients are weight-bearing right away, which in the human field, when you suture a meniscus, you're going to be non-weight-bearing or non-loading for a period of time.
Yeah, so, my wife had that, Doc, and had the sutures, and she wasn't walking on it for a while.
Yeah, no, exactly. So fortunately, we don't have to worry too much about that because the configuration of the meniscal tears are different altogether. So a lot of times it's just basically go in there and then remove what's torn. One, because you remove that instability, and then two, you remove all that kind of foreign body effect that you have in there, so you can allow then the joint to settle, and then you have to go no different than in the human athlete through a level of physiotherapy that sometimes takes anywhere from 6 to 12 months to be able to build up some of the core musculature and periarticular musculature to basically be able to help sustain that stifle and bring it back to health.
Oh my gosh, this sounds exhausting, very difficult. It sounds like to me, Doc, if you could just go in there and with the arthroscopy, just inject some of that pillow collagen in there and it'll fix it right up.
Yeah, that would be great if it would be that way. Yeah.
Doc, thank you so much for joining us. I know you've got to go into surgery right now. Where can people get a hold of you and learn about New Bolton?
Yes, so you can definitely, you can search us. Our webpage is vet.upenn.edu. And within that, you can look at the New Bolton Center, and then you can see everything that we're doing here from clinical research and scholarly stuff, type work.
Well, there you have it. Horse Radio Network has thousands of engaging podcasts for horse people, and you can have them sent right to your phone. Just subscribe via your favorite podcast player. This is Coach Jen, and I will be back again soon with another tip. Until then, go ride your horse. The Horse Radio Network and the Horse Radio Network hosts are not responsible for statements made by guests on the Horse Tip Daily. Please use your own judgment when listening to the tips on this show.